Hey guys, this is your inspirational nurse _RNT era coming to you live with another great video. Hey, hello all my new inspiring nurses out there. Welcome to my channel. For those who are coming back, welcome back. I miss y'all. And today's video is going to be about a low blood pressure doctor's response in my experience and what I was always taught as a nurse with certain situations, right, regarding patient safety and patient care. So let's just jump into this topic. Now, guys, for those who are new, I am currently an RN on a med-surg cardiac unit. And so these are my next 3 final last days of orientation. My preceptor decided to go on night shift with me. It's a requirement for your orientation, but usually it's 2 weeks, but I talked my way out of it because I did 2 years of night shift and I'm ready to be a day shift nurse. Now, I will do another video on day shift versus night shift because I'm hired as a day shift nurse, but this is just the requirements for all new hires. You have to do some time on nights. They claim it's for they want you to have a vision or some idea of how night shift works. Now, I just think it's an excuse to just put people on nights because maybe staffing or whatever. That's what I think. But definitely have some support from management. And so I only have to do 3 nights, which is coming up Thursday, Friday, and Saturday night. And I'm like dreading to do night shift. Now, I used to always be a night shift girl, but with this RN work, y'all, I am not looking forward to it. It's just so much, period, in working in the hospital in these times, let's just say that. Now, let's just cut to the chase. So this week, guys, right, I did a previous video on my diary, part 3 of my med-surg skills that I performed, how many patients I had, and my experience on a unit. This is just a particular situation I'm just going to talk about to all my nurses out there that definitely works in the hospital and have to, work with certain providers. So guys, let's talk about low blood pressure, high heart rate, right? We know that might be an indication of a sepsis or something, right? Now, I had tons of patients for some odd reason for the last 2 days that I worked that their vitals were all over the place. Again, I did a diary entry, as I stated, on a med-surg cardiac unit. Your patients have more presentation. They present their symptoms. You'll see them more than when you're on different med-surg floors, right? And so I had a lot of patients where their vitals was trending very, very low. Blood pressures were like 80s, low 80s. And I was just like, what is going on? Like, it's been like trending. And so tip number 1, when you have something that occurs and someone like an NCP reports to you that your patient's, blood pressure is extremely low, heart rate was extremely low, you definitely, number 1, want to do is check it on the opposite arm. Make sure they don't have restrictions, right, on checking it on that limb manually, right? And then you want to go into their chart to see if your patient has been trending low and has it been something that's been consistently. So when you report this to the doctor or a hospitalist, right, you will have some data you can actually give them to work with rather than just stating what you just felt like in a moment, or just one fact. You need multiple things. And, the first question a provider is going to ask you when you are reporting something that's a change in your patient for a couple of days, they're going to say, is the patient symptomatic? And so, guys, let's talk about symptomatic, right? So in nursing school, if you guys haven't been to nursing school yet, that's fine. They always teach you that when it comes to any issue that goes on, something that's acute or something that's been occurring, usually that's the vital signs are the late stages of symptoms, right? Now, vital signs are not the first symptoms that usually trend, right? When you have your patient and something is wrong with your patient, that's usually the last indication that something is already happening. So guys, right, my patient had low 80 blood pressures. Trending it. I was holding spironolactone, metoprolol, like whatever BP med, diuretics that they had, I was holding it, right? Because we want to use our nursing judgment, and we want to say, okay, we're going to have to hold these meds to try to stabilize our patient and not bottom them out. Now, I brought this up to my provider's attention, and again, I got a little attitude. Now, I don't know what is wrong with some of these providers, y'all, but you're definitely going to come across some providers, especially just maybe working in these times, they're very frustrated, like maybe overworked. I don't know what it is, but they're just like they just ready to explode, if that makes sense. Now, your girl can handle herself. So I told the provider, I said, look, my patient blood pressure is trending very, very dangerously low. And are you very aware of this situation? What do you want to do? Like, we got to do something about this situation. The provider was saying to me, is he perfusion? Isn't he peeing? Like, then it's not a damn thing I could do for him. He's just very sick or something like that. And all I know, when I heard that last part, maybe I blocked out for a minute, I couldn't believe what I was hearing, because I was like, first of all, it's my duty. Because he was like, you don't have to tell me every time or everything. Yes, I do. You are the provider for this patient. So it's my duty and my job to tell you about your patient, because it is also my patient. So, right? Because we don't want our patients to die, or we don't want our patients to have to be rushed to the ICU or something because, we wasn't staying on top of it. Especially if it's something that's a known factor, right? A change. And then when I say go back in their chart, dig deep back, weeks and weeks back to see what happened, when they started to trend this way. Now, guys, once I got that report, I was like, I'm not going to tell you a damn thing then, because these are your patients, like, you don't got to come at me like that. First of all, I'm just doing my job as the nurse to say that there's something wrong. Obviously, there's something wrong because the man been trending low for a couple of days now, okay? Heart rate goes up, BP goes down. And so, I was able to walk away. And then I was still kind of mad, y'all. It was still heated. Because I'm like, what's going on with me and these providers? Like, we just got to talk about it. Because, like, this is just too much, right? So, come to find out, right? I walked away. And I had to call the same provider, y'all, for another patient, right? Provider said he's going to discharge the patient and never put the orders in or anything, right? And patient is waiting. Family is waiting. And it's like, okay, you said you was going to let me go. And when the patient is getting ready to go from a hospital, y'all, they DC all their meds, their fluids, they discontinue everything. That's how you know they're going to be going home, right? And so this patient is a sickle cell patient, and now you DC'd his meds, his pain meds and everything. So I was just like, okay, so, all right, so you send this patient home. What are you doing? What's up? So another tip is that I learned is you definitely always want to, in these times, and I know it's hard, y'all, but in these times, you definitely always want to stay professional. You don't want to give somebody a reason to say that, you're not a good nurse or you don't know how to communicate. You definitely want to stay professional, because you're definitely going to be working with these people all the time. And you just never know what somebody is going through. I mean, we all going through, but that is not an excuse for, our patient not getting the best care. But there is always a reason, right? So anyway, and if somebody come across you, that's a good indication that you need to pray for them. There's something that's going on. You just need to pray for them. And it took me years, y'all, to get to this point, because, y'all, I would just let loose with this mouth, y'all, and be without a job. But it's not a reason for me to, worrying about losing my job. It's just keeping my character. Keeping your character is very valuable than being known as someone who's aggressive or, or being known for, a nurse that don't know what she's talking about, because you got to work with these providers, right? And so we both under stress. Like, I'm extremely tired, y'all. Okay, and that day I had 7 patients, but I stayed on top of it. And then when I came in the next day, y'all, come to find out, my patient had to be rushed to the ICU because the blood pressure dropped to the 70s this time. and the heart rate shot up above 200. I was like, oh my God, like what? So I'm learning, guys, especially as a new nurse, you have to advocate for your patient. Don't matter the backlash you may get, is going to save your life. Don't be known for that nurse to just stay quiet and just trying to, be friends with everybody, because everybody's not gonna like you as a nurse. Don't matter if you try to stay quiet and go, yes sir, yes ma'am. Now your patient dies, or something goes wrong with your patient, right? We are all responsible, and that's the scary part. When you're especially working in these times, you are responsible for your patient. You are responsible to ensure that they get the care, and it always falls on the nurses, y'all. And it's just so frustrating, because it's like, we try to do everything we can, right, to stabilize our patients. We try to come up with ways to stabilize their blood pressure, right? But we are not providers, we are the nurses. But we do whatever we can to, increase his fluids, right? Position him differently in bed, right? Because gravity and blood pressure, so many things. But once the vital signs start to get funky, I always call them funky when they're abnormal, that's the late stage, that something already happened to the patient, right? It's just a matter of time when it's going to happen. So don't be the nurse to be afraid to speak up. Be known for the nurse that advocates for your patients, because that's the goal. That's the job of a nurse. Now, like I said, that might take you off the friend list for different providers, because I know some nurses, they want to be nice and friendly with every provider, but it's impossible. Everybody is so stressed out, and I'm going to restate that. When I come home, y'all, I don't even know I fell asleep. I'm so exhausted. I don't even take my clothes out. I didn't charge my phone for the next day, nothing. Because as soon as I get in the house, eat anything, I'm asleep. It's no joke. It's so much work to do, and the accountability is so heavy. That's why it's so important to say, and you must document what the provider stated. Make sure you made them aware. Make sure you write their name out. Doctor, MD, so-and-so, so-and-so. Or hospitalist, so-and-so, so-and-so. Stated, quotation marks, or whatever. You have to cover your butt. And I never really had to cover my butt as a LPN, because our patients were stable. We didn't have too many issues with providers. I had some providers that really didn't know what to do. They always asked the nurse, what do you think? What do you recommend? Providers don't know everything, guys, and nurses don't know everything, right? So that's the scary part. So you can't trust somebody because they have the credentials. Doesn't mean that they know what they're doing, working actually with real patients, right? Working with real diseases and diagnoses, right? So we learn every day. So please don't be the nurse to back down or don't say nothing at all, and then something happens to your patient. You will always have that on your mind. A good nurse speaks up and say, nope, something is not right. You need to go check him. You got to speak up, because we're all tired, but that's no excuse for not doing a great job, right? And so, y'all, that's what's the moral of the story. And when I found out the next day, I was really hurt that my patient had to be rushed in. This is the second time I knew something was going up. So it's important also to know your protocols in your hospital, because if you suspect of C. diff or sepsis or anything, you can go ahead and put the protocol in place without the provider, call the provider for everything. You do always have protocols in place for certain things, right, that you could go ahead and just do, right? You put the motion into it and just do it, right? And so anyway, yes, your girl is surviving. I got 3 nights coming up in night shift. Then I have 3 days that they call elective days, when I get to pick to the ER or ICU or the OR or whatever specialty area. Of course, I chose critical care, y'all, because that's what I am. I know I am. I just need time to get there, because this already is a lot. So to do critical care in these times, not rushing, right? But I'm definitely going to be going to those areas. So I'm also going to do a diary entry of the ER and ICU in these times, because y'all know we still got COVID patients, right? And so policies are changing every day for these hospitals. Now patients have to wear masks. We always have our mask on and goggles. Guys, update, I did my first COVID-19 swab in the nose type of thing, and almost got really beat up real bad. I mean, and doing the test, y'all, I was scared. Now, we used to have COVID-19 nurses, designated nurses that were doing all the tests for the whole hospital. But now that it died down somewhat, we have to do them on the floor, and we just have to get the equipment and stuff and the special test to test them. So I was like nervous, y'all. I had to go get my N95, and I held on to that baby, right? I washed her down. I'm like, I'm packing you up just in case, right? And so my patient that I had to do it on, y'all, was so already confused and disoriented. So imagine, y'all, I felt so bad just doing it on this lady, because I felt like she wasn't really consenting. Like, she really just she wasn't in her mind to understand what was happening. So I just really felt bad. But I'm a little holistic, but I did it, and I quickly did it, because once you put that N95 on, y'all can't breathe. So anyway, I quickly did it, snapped the thing, put it in a liquid, closed the tube, wrapped that sucker up, and sent it as fast as I could. And she was negative. So I was just so like, because my preceptor was like, I'm not going in there with you when you do it. I was like, oh God, yeah, I know, because I wouldn't want to put nobody else at risk, right? And so I did my first COVID-19 swab. It was an easy test to perform. It's just the whole mental thing about it when you're doing it, because you're like, what if this patient is, So anyway, and that's the policy for them to be able to go and get discharged to another facility like rehab or something. They have to be negative. So, and some people get the test done more than once. So you don't want to throw your N95 away, because you may have to repeat the test the next day, right? So anyway, that's just FYI. So anyway, I just wanted to put this out here. I hope this story, moral of the story, was super helpful. This is where I'm at. Still love what I do. God is good. Been nominated for like four or five times already for an award. Just don't know yet how the award thing works, if I'm even gonna get it. I'm sure, I don't know. But definitely another thing is, guys, that experience is a lot of harassment in the hospital. And it's just a little quick FYI. Have patients that was really inappropriate, like trying to holler. I mean, I don't know what y'all call it, but in my, like, where I grew up, we used to say trying to holler. But I mean, trying to holler, trying to bag, whatever y'all used to call it. But I'm taking it back, y'all, old terms. But a lot of harassment, like trying to find out where you live at, like saying inappropriate things. And it's just so annoying. It's always these older guys. And I'm just like, if you just don't get your sick self and go sit down, right? I had some guy say diggity wiggly to me, like, oh, I got my diggity. I'm like, what? Like, okay. So with those situations, you need to let your patient know that, no, I'm not sweetheart. I'm nurse, Miss Nurse, or Tiara, or whatever. I am not sweetheart or cutie pie or anything like that. I'm here to service you in a professional manner. And if you have a problem with that, take that with my manager. We're not doing this. Basically, we're not. You're not going to talk to me like that. You're not going to say those things. It makes me feel uncomfortable. Don't like it. And sometimes, no matter what, they still do it. But if it gets out of hand, just take it up with your manager. Don't wait till it gets too far, because you'll be surprised what a patient might try to do. People are lonely. People are in a hospital and they can only have one visitor. They're lonely. People have needs, right? And so you just want to be mindful of that. Make sure you chart everything that happens, your conversations with family members, your conversations with your patient. You gotta cover your butt, guys, like to that extreme, because people are like flipping it. Like the people that have been really nice to you, especially speaking to a lot of wives and their husbands in the hospital, they sound like they want to know every little thing. I learned, say less is more. Sometimes you don't want to open up a can of worms and say too much. Oh yeah, the doctor said that the test was this, and they had this done too, and this came out like this. You want the provider to answer the questions for the patient, right? You are the nurse, right? Not saying you cannot say something, but you don't want to put that responsibility on yourself, and you might say something wrong, right? Or give the wrong information. And then they like, well, that nurse told me, because a lot of family members write stuff down. They got a notebook and a pen, and they like, what drug they on? What you said they. So what I learned to do now, because of course I like to talk and engage with my family members, I'm the nurse that will update you twice a day, before when early in the shift and at the end of the shift. But I learned not to say too much, y'all. Right? Just make sure you be like, oh, do you want to speak to the provider? Put it on the provider. Don't be like, yeah, so they had this drug, and then this happened, and then this dropped, and then this went back up, and then this, because then they're gonna be like, well, what you did, and what happened, what the doctor said, because he said. And so it turns into something that it shouldn't be. So just be mindful, and always read the notes for your day or the day before from the provider, if they had like respiratory that came and found something, if they had a test that was done, or case manager put a note in. Always read those notes so you can stay on top of what's going on with your patient, literally, right? So anyway, last tip. So I hope you guys are having a fantastic day. It is 70 degrees today, so we went for a nice stroll, got some vitamin D. Now I'm about to chill, got my little wine, y'all, and I'm off for a few days, which thank God. Now I get to make my own schedule. Actually starting next week, I'll make my whole schedule for 6 weeks. Only work 2 weekends out of 6 weeks. And I can't get floated. I only could go up to 6 patients, which 6 is a lot too. But whatever. And it's a lot of perks to the program that I'm in, and I'm super excited to pick my schedule and just do it the way I want to do it. I've been following my preceptor schedule. She works every weekend, so like imagine that, y'all. All my Saturdays has been gone. I'm sleeping on Sundays. I've been missing church, so it's just been like a hot mess. So anyway, if you guys got any requests y'all want to see, any topics y'all want to know about, or something that, or some tips and tricks from me, please send them to me. I can use any help right now. I'm still new at this thing, y'all. So just keep me motivated, y'all. I appreciate the love and the support. Really, really, really appreciate it. And I'll talk to you guys later.